In light of Jolie's news, we take a look at the pros and cons of choosing to undergo a double mastectomy as a way to prevent breast cancer. Danielle Woods, live outside of the Regional Cancer Center with advice from local medical experts and a personal testimony, Danielle, from a cancer survivor herself, right?
Yes, Jill, that's right. You know, there are many different factors that can help you determine whether or not getting a double mastectomy is right for you. Those factors include your family history, genetic mutations, and for one woman, it was a decision she had to make because she says it gives her peace of mind.
Jenise Kaliszewski was diagnosed with stage 2B breast cancer, literally the same week she got the best news of her life.
And it was a few weeks later when I went to get my MRI and had a blood test that I found out that I had actually gotten pregnant the same week that I got diagnosed with cancer.
As she holds her newborn daughter, Brenly, she smiles, realizing how fortunate she is to have a healthy baby despite undergoing chemotherapy.
It was a miracle, complete miracle.
Jenise was faced with a difficult decision, one many breast cancer patients face, whether or not to get a double mastectomy.
For me and my peace of mind, that was the best decision at the time, and I'm really glad that I did it that way.
Although she only had cancer in one of her breasts, she says she now feels far less anxious knowing her cancer can't come back in the other. But some women are choosing to undergo a double mastectomy as a preventative measure against cancer.
The general recommendation is that women do not need that unless they have one of these mutations.
Christopher Marsh is a medical oncologist at the Regional Cancer Center. He says a double mastectomy is typically only advisable in people with high risk factors such as genetic mutations, history of family members diagnosed at a young age, and if you are a man who has had breast cancer. Following an assessment of your risk, testing for the genetic mutations should be done. But Marsh says the best way to prevent cancer is to make sure you keep up with your regular doctor's appointments.
To make sure that you see your doctors, you get your screening tests. You're not only getting breast exams and mammography, but getting your pap smears, getting your colonoscopies, all of those things to help prevent the development of cancer.
Dr. Marsh says less than 10% of people who have breast cancer are those with the genetic mutation, but still with that small statistic, typically he advises against people going ahead and getting that double mastectomy as a way to prevent themselves from getting cancer. Jill and Sean?
Danielle Woods, thank you for that report.